So today we want to talk also about sealings. A lot of people ask us when and if they should have them done, and it has to do with the physiognomy of the tooth, and I'll let the specialist discuss that with us.
First of all, we have to understand why we need a sealing. And we talked in one of the previous subjects about prevention. And specifically in that subject, we talked about the formation of tartar and stone. Sealings are done usually at the level of the fissures of your tooth, which means in the deepest part of the surface of your back teeth, where you bite on and where you chew. In that deepest part, usually we have a tartar production in case we don't brush properly. And this improper brushing is due to the fact that with our toothbrush, it is very difficult to go till the last surface of our tooth, which is usually the second molar or even the wisdom tooth in some cases. And if we don't brush permanently and very efficient those surfaces, then small tartar surfaces are created in the deepest point of our fissures. In those cases, very close monitoring is needed. And in our clinic, we communicate to the patient that this process of depositing tartar in your fissures is happening, and we are monitoring further on if the patient is improving his or her brushing technique at home, and if after 6 months the tartar didn't disappear, then we suggest a cleaning with a diamond drill, with a very sharp and pointy diamond drill to clean this tartar out of the fissures, and then seal them so that this tartar cannot build on further. The interruption of the producing of the tartar in your fissures is very important, because as you heard also in the previous subject with prevention and cleaning and scaling is necessary, because the tartar is destroying the enamel surface of your tooth. And the same thing happens in your fissures. Once the enamel surface is destroyed in the lowest point of your fissures or the highest point of your fissures, then the bacteria which are accumulating in that tartar can produce cavities. So sealing is actually also a prevention measure of preventing cavity processes to happen. Our philosophy is always to try to apply treatments in a way so we can use the healing forces of each human organism, and to try to guide patients to make effort at home so that we don't have to damage tooth tissue too early. So that's why we like to monitor first these tartar productions in the fissures of your teeth, and then decide after knowing the efficiency of your hygiene, of your brushing methods, which you are doing at home, to decide then if we use sealing or not. The treatment of sealing is extremely important because it can prevent further damage of your tooth. We talked in a previous subject about the fact that the outer layer of your tooth enamel is produced all the time, and it's renewed all the time. So if I damage a tooth by removing the tartar production in your fissures, I can do it usually without using anesthesia, because the enamel layer where the tartar produces, if done in time, is not damaged completely. So your tooth will not feel the sensation of pain when I clean the tartar out from your fissures. And once I seal that place, due to the fact that enamel is produced all the time, in time the sealing will fall off and the tooth will be integer again. So this is another aspect of prevention dentistry for saving a tooth from a process which we call cavities. That's why sealing is as a treatment is very important.